Good afternoon, everyone. Welcome to the September Wellness Webinar. My name is Kristen Kayla, and I will be the host of the webinar today. I'll be on the line to assist Deepa, the presenter of the webinar today, and I do have a few housekeeping items to review before we begin the presentation. So first of all, participants are muted upon entering the webinar to avoid any background noise and distractions. Next slide, please. And if you are having any technical difficulties, please feel free to chat directly to me. To open that chat box, go ahead and hover over the Zoom toolbox on your screen, and you'll see the chat box icon there. And simply just click on that icon and the chat box should appear. And I will receive your messages in real time, and I'll respond to your message in the order that I receive them. Next slide, please. Okay, for the disclaimer, we always like to review this during our presentation. The information provided in this presentation is intended solely for the general information of the audience. It is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. Next slide, please. Today's topic is beating the winter blues, coughs, colds, and flu. The presenter for today's webinar is Deepa Thakur, a quality improvement specialist here at HealthNet. Deepa, thank you so much for your time today. I look forward to your presentation, and you can begin the webinar. Thank you.
Hi, everyone. Good afternoon. Thank you so much for joining. As Kristen mentioned, my name is Deepa Thakur. I work here at HealthNet, actually a teammate of Kristen's, and I'll be co-hosting the presentation with her. Thank you again. Thanks for joining. And the title again is Beating the Winter Blues, Coughs, Colds, and Flus. Before I move on, just wanted to confirm, can you all hear me okay? Kristen, is the sound coming through okay?
Yes, I can hear you clearly. Thank you so much for checking.
Perfect, thank you. So these are the four main topics I will cover during the webinar. So 1, differences between the cold, flu, and COVID-19. 2, how to stay healthy during the cold and flu season. 3, social changes for the holidays yet again. And 4, foods that can help boost immunity during the colder months. So it's September, and many of us are still enjoying the warm weather and trying to keep cool. So why am I talking about preparing for winter so early? As you know, it's the beginning of flu season. Flu season typically peaks in January through March. However, in the past, we've tended to see 2 peaks. One as early as the holiday season, which is coming up, and then another as late as springtime during April and May. And with COVID-19 still in our communities, it's still really important to expect the unexpected this flu season and to always be prepared as we did in 2020 and just do so as best as we can. So every fall, we all brace for cold and flu season and hope nothing interferes with our holiday plans. Influenza, commonly known as the flu, is a contagious illness caused by viruses that affect the nose, throat, and lungs, sometimes in similar ways to a common cold. Flu symptoms include fever, body aches, chills, headache, congestion, and coughing. However, the flu can also lead to more severe illness and can even lead to death. And this can happen with the elderly, babies, those who are pregnant, and anyone with a compromised immune system. The flu is shown to be much more dangerous than a cold, and symptoms can be more severe. So while both cold and flu are caused by viruses and share similar symptoms, there are some differences to note. Typically, colds begin slowly about 2 to 3 days after infection. First symptoms are usually a scratchy, sore throat, followed by sneezing and a runny nose. Body temperature is usually normal or only slightly elevated, and then a mild cough can develop several days later. The symptoms tend to be worse in infants and young children, who sometimes can run temperatures of up to 102 degrees Fahrenheit. Cold symptoms usually last from 2 days to about a week. In contrast, Signs of the flu can come on suddenly and can include headache, dry cough, chills, and muscle or body aches. These symptoms can quickly become more severe than that of a cold. The flu sufferer often experiences what you might notice as a knocked off your feet feeling. Sometimes fever of up to 104 degrees is common. The fever typically begins to subside on the second or third day, and then respiratory symptoms like nasal congestion or sore throat may kick in. Fatigue and weakness from the flu may continue for days or even weeks after the infection. So if you are experiencing flu symptoms, you might also wonder if you have COVID-19. So what are the differences between flu and COVID-19? The flu and COVID, they are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with coronavirus, the SARS-CoV-2 virus, and the flu is caused by infection with an influenza virus. Because some symptoms of flu and COVID may overlap, it may be hard to tell the difference between them based on symptoms alone, and testing may be needed to help confirm a diagnosis. Flu and COVID do share many characteristics, but then there are some key differences between the two. The differences between both viruses, you can see that in the chart shown on the slide. One thing that's not noted on here, so a different sign that's unique to COVID-19 is that it may include change or loss of taste or smell. Typically, for COVID, a person develops symptoms 5 days after exposure. Sometimes symptoms can appear as early as 2 days after exposure or as late as 14 days after exposure. And the time span that the symptoms last can vary. With the flu, typically a person develops symptoms anywhere from 1 to 4 days after exposure. So what are the similarities between the flu and COVID? There are many similarities in the way flu and COVID-19 spread. Experts believe that flu and COVID viruses spread mainly by droplets or tiny particles that get sprayed when a person with a virus coughs, sneezes, or even when talking. These droplets can land in the mouths or noses of unsuspecting people nearby. It's possible to spread to others up to about 6 feet away just through coughing or sneezing. Less often, a person might get sick by touching a surface or object that has been contaminated with the virus and then, touching their own mouth, eyes, or nose. That's why it's so critical to wash your hands frequently, especially if you're sick, and that would be to avoid leaving traces of the virus behind. COVID-19, particularly the Delta variant, is more contagious than the flu virus. The best way to help prevent illness is to avoid being exposed to the virus. And some ways to do that is wearing a mask in public indoor spaces, washing your hands frequently for 20 seconds, and to minimize the risk of getting serious illness by getting a COVID vaccine. Similar to the flu, the virus is understood to spread from person to person. And that could be between those who are in close contact with one another. And that's about 6 feet apart at a minimum of 15 minutes. And some of the main differences between the cold and flu is COVID can also be spread by people who are not showing symptoms. And some who have been infected and tested positive for COVID may also experience long COVID, having symptoms lasting longer than the 14 days. So who is at higher risk for severe COVID? In general, your risk of getting severely ill from COVID increases as you get older. In fact, in September 2020, before the vaccines became available, the CDC reported that 8 out of 10 COVID-19 related deaths in the US were among adults aged 65 years and older. COVID continues to be a risk among older adults, for children under the age of 12, and adults of any age who still need the COVID vaccine. Unvaccinated people continue to face serious risks from COVID and are encouraged to get the vaccine as soon as possible. So at the moment, the Pfizer COVID-19 vaccine is available for use for adolescents aged 12 to 18, and it's FDA approved for adults 18 and older. There's also Moderna and Johnson & Johnson vaccines. both emergency use approved by the FDA for adults 18 and older. Even once vaccinated, it's still so important to take appropriate precautions to prevent the spread when you do interact with others. So we're still continuing to learn more about COVID to this day. We know that older adults and people who have chronic conditions like heart disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. The chart on this slide provides a more comprehensive list of other medical conditions that may increase the risk of severe COVID illness. So adults with the following conditions are at increased risk. These medical conditions can also increase the risk of severe illness of COVID in children. And something that is noted by the CDC, this list, it does not include all potential medical conditions that can make a person more likely to get severely ill. So rare medical conditions may not be included on the comprehensive list from the CDC. However, a person with a condition not listed here may still be in more danger from COVID than persons of similar age who do not have said condition. With that said, make sure to talk with a doctor on how to best be protected and minimize the risk for you. At the same time, it's really important to keep taking preventive measures for COVID. Just mentioning it again here, things like vaccination, wearing a mask, frequent hand washing, and physical distancing. All of these are really important steps, especially if you're older or have multiple or severe health conditions. So is it the flu or COVID-19? If you do start feeling sick and think you may have COVID, you may need to get tested. Keep track of your symptoms. Most people have mild flu-like illness and are able to recover at home. However, because some of the symptoms of flu, COVID-19, and other respiratory illnesses are very similar, the differences between them cannot be made based on symptoms alone. Testing is needed to tell what the illness is and to confirm a diagnosis. According to the CDC, people can be infected with both flu and the virus that causes COVID at the same time and have symptoms of both flu and COVID at one time. It's also helpful to note that the CDC has a symptom checker where you can enter information about your symptoms to see if testing is recommended. Many healthcare provider websites will offer this information as well, along with online resources and a COVID-19 advice phone line where you can call and discuss your symptoms with an advice nurse. And just be sure to get in touch with a healthcare provider within 24 hours of exposure to COVID. Especially if you have concerns or start experiencing any worrisome symptoms. Many medical providers, they also have started offering telehealth, so you can schedule a video visit safely from your home. And just something else to stress, remember to seek medical care immediately for any of the following emergency warning signs. So this would be things like trouble breathing, persistent pain or pressure in the chest, any new confusion, inability to wake or stay awake, or bluish lips or face. So this list that I provided, it's not all possible symptoms, but please make sure to call your medical provider or doctor for any other symptoms that are severe or concerning to you. And if you do call 911 for any emergency issues, do notify the operator that you're seeking care for someone who may have COVID-19 so that they are aware and can take necessary precautions on their end. So if you do get the flu, you can treat mild flu symptoms at home. So here are some self-care tips that you can take. Get plenty of rest. If you do have signs of the flu, do your best to avoid exposing others to the virus. You can take over-the-counter pain medication to manage symptoms, such as aspirin, ibuprofen, or acetaminophen. Ask your doctors for alternatives if you do have allergies to any of these medications. Know that pregnant women should not take ibuprofen and children should not take aspirin. Make sure to drink plenty of fluids, especially water, soups, and drinks with electrolytes. For any individuals at higher risk, for complications from the flu, antiviral medications may be prescribed by a doctor. This would be upon early diagnosis to reduce the severity and duration of illness. Antiviral drugs, these are prescription medications available in the form of pill, liquid, or as an inhaler. And as mentioned before, they can treat symptoms caused by the flu like stuffy nose, cough, fever, chills, aches, and they make the illness less severe and shorten the recovery time by 1 to 2 days. Know that antiviral drugs are not a substitute for vaccinations against the flu, and you should make sure to talk to your doctor first to find out if you can take this medication, if it's the right timing for it, and if it can address your flu symptoms. And for COVID, if you do get COVID, know that mild COVID symptoms can be self-treated at home too, but you should still be watchful and monitor symptoms and track them every day. If possible, stay at home and quarantine if you can in a separate room with a separate bathroom, if that's possible. Most people can recover at home, and don't leave your home except to get medical care, and don't visit any public areas. You should also get tested to confirm a positive or negative result, and just as mentioned before, continue to monitor your symptoms. Take care of yourself, get rest, and stay hydrated. You can also take over-the-counter medicines such as acetaminophen to manage symptoms. And also wear a mask over your nose and mouth if you must be around other people, even when at home. And clean your hands often, washing them for at least 20 seconds each time. And just stay in touch with your doctor. Call before you get medical care, and do so. Reach out anytime there are symptoms that are severe for you or concerning. So staying healthy during the winter months. So it's going to be really important to stay well this cold and flu season, especially with COVID still in our communities and now with the Delta variant spreading. So what else can we do to stay healthy this winter? So here are some everyday prevention actions you can take. First and foremost, you can help protect yourself and others from the flu and COVID-19 by getting vaccinated. The Delta variant is spreading and found to be more contagious than that of the flu. Plus, COVID-19 can be spread by infected people who exhibit no symptoms. So what else can you do to protect yourself? There are many ways to prevent or minimize your risk of infection. As mentioned before, get the flu and COVID vaccines. Current guidance on the COVID-19 vaccine states that it may be administered with other vaccines, including at the same time as a flu vaccine. Some other actions you can practice daily include covering your sneeze and cough, not with your hands, but covering or sneezing into the crook of your elbow instead. Also avoiding touching your face and washing your hands before touching eyes, nose, ears, and mouth to prevent introducing bacteria or viruses into your body. Wash your hands often, especially after handing money or any other frequently touched items. Wash your hands before meals, after using the bathroom, if blowing your nose, and do so with soap and water for 20 seconds. Avoid making contact with sick people or shaking hands, hugging, and trying to put physical distance between yourself and others if they have a cold or exhibit those sort of symptoms. Routinely clean objects that are touched often, like doorknobs, phone, keyboards, and shopping cart handles. If you're not feeling well, try to stay at home. And then in general, you can also use everyday healthy habits, such as decreasing stress, because stress deters the body's ability to fight off infection. Try to get enough sleep. About 7 hours or more will allow the body to rest and recover and fight illness. And then also eat a balanced diet, such as adding fruits and vegetables, which can boost your immune system. Things like strawberries, blueberries, and oranges, which are rich in antioxidants to boost your immune system. And especially with COVID-19, we've been advised to clean our hands often, washing hands with soap and water for at least 20 seconds, especially if returning from a public place. If soap and water are not readily available, you can use hand sanitizer that contains at least 60% alcohol. And when using that, cover all surfaces of your hands and rub them together until they feel dry. And something else to stress, I know I keep saying this quite a bit, but the best way to protect yourself from getting the flu and COVID-19 is to get vaccinated. Getting vaccines during this time of year is ever more important. Yearly flu vaccines are safe and they're available for everyone 6 months and older. There's also 3 COVID-19 vaccines available: the Moderna, Pfizer, Johnson & Johnson vaccines. Pfizer's COVID vaccine is officially approved by the FDA for adults, and it's safe and recommended for ages 12 and up. So the flu itself, it can be a really serious condition, especially if a secondary infection brought on by the virus, such as pneumonia or bronchitis, develops. And at the same time, COVID-19 may lead to severe illness too, or hospitalization, which the vaccine can help prevent. Vaccinations are recommended by the CDC as the first and most important step in helping to protect against serious illnesses. And last line on the slide, don't wait, vaccinate. This is a California campaign. It was designed to remind parents and adults that it's essential to keep getting routine vaccines and stay on that schedule. While staying at home during the initial COVID-19 outbreak did help to slow the spread of the virus, it also resulted in delays and decreases in rates of children and adults getting their recommended vaccinations. So now that school is back in session, infants and children who may not be protected by those routine vaccines could be vulnerable to diseases like measles and whooping cough. Similarly, adults who are not vaccinated now may be more vulnerable to diseases like shingles or pneumonia. Remember, it is safe to come in for a routine vaccine. We understand the uneasy feeling about coming into a doctor's office these days, but know that you can call ahead to find out what steps many healthcare settings across the state are taking to ensure patients are safe when visiting, especially during this time. And as mentioned before, remember, you can receive COVID-19 and other routine vaccinations, including the flu vaccine, at the same time, but be sure to check with a doctor or a pharmacist to get more information about this. So now that we've put our health first, we can start thinking about what we can do to enjoy our time during the holidays. Since COVID is still in our communities, be sure to follow any rules or guidelines in effect. You'll find your local, county, and state parks are doing everything they can to create a safe space to enjoy outdoor activities. And I think because of that, there's so much to see in California. We're lucky we're able to spend time outside during some of the fall and winter months. So when you are looking to spend time outside, look for parks with road width trails to allow you to enjoy the trail safely and practice social distancing. If you are interested in camping, check for updated rules at campgrounds, but know that not all campsites will be open and allow social distancing. You can also check local open space preserves, places like hillsides, trails, and wildlife habitats that can allow you to be connected to nature and outdoor open spaces. It's really important, as being in nature provides more physical and mental health benefits. Some examples of safe activities you can do solo or safely outdoors with a few other people would be, sitting under a tree, reading, writing, listening to music, or drawing. You can take photos of plants and animals, or just sit and enjoy a scenic view. You can do this in a healthy and safe way outdoors with some advice from the CDC, like staying 6 feet away from people you don't live with, following CDC's guidance on personal hygiene prior to heading to trails, so washing hands, carrying sanitizer, and wearing a mask that covers your nose and mouth. For indoor options, you can move your exercise routine indoors. For example, you can do a video cardio workout or interact with a mobile phone app like the Nike app for a workout in your living room. There's things like yoga, Pilates, Zumba. Pick something you like so you can stick with it. And bring in some friends and try to do things together, even in a virtual way. You could also try something new. Maybe you wanted to learn to dance or kickbox or martial arts. Maybe that can be something you could do as a virtual class. Just take advantage of some of the discounted gym memberships during this time or any free online offerings, anything on YouTube. And if you cannot get outside or you prefer to stay at home, look for opportunities to experience nature by participating in virtual nature events like live streamed outdoor events or programs that can keep you connected to nature and you can tune in from the comfort of your own home. There's things like tours of national parks, nature preserves, and urban open spaces. There's outdoor art lessons that you can stream or engage in. There's native plant walks. These are just some examples. So they're not necessarily physical activity, but the images can do wonders for your mental health and it can positively impact your physical health as well. And as mentioned before, if you're not able to join in a program live, most will be uploaded as full recordings, maybe on YouTube or another streaming platform, so you can enjoy the event after at any time. So COVID fatigue, it's still ever present. We're tired of being cooped up, tired of being careful, tired of being scared and of the uncertainty. Our collective fatigue can make it harder to keep with these pandemic restrictions. However, facing this fatigue is important for our personal health and for beating the coronavirus that has upended our idea of what is normal. Many people understand this, which adds to the exhaustion and stress. Kay Hermison, a UC Davis health psychologist, said once that eventually the heroic spirit wears thin as the difficulties and stress build up. That's when we hit the disillusionment phase. She goes on to say, we lose our optimism and start to have negative or angry reactions. We ask, what are they doing to fix this? How long will this last? This is a real challenge. There are no easy solutions. So that's about where we stand now as a society. So what can we do to help us cope in this situation? So the first thing, exercise. I think it's one of the best things we can do for coping, and it helps keep ourselves occupied in a healthful way. Even taking a short walk outside or in your room and just pacing while you're thinking about something else. The next one is talking. Saying what you're feeling out loud can do wonders, and talking to a friend or a loved one on the phone is also a helpful tool for coping. Constructive thinking. It's really helpful to adjust our thinking despite our circumstances and try to be compassionate with yourself and others during this time. And lastly, mindfulness and gratitude, both ways to form a deep acceptance and fully appreciate a present moment. So let's look at mindfulness a little bit closer. Mindfulness is a deep acceptance and focus of the present moment. It's an inner space where thoughts, feelings, and memories can be observed with curiosity. We can take a step back and observe our thoughts, feelings, and memories without judgment. So how can we be mindful in the wintertime? First thing, consider appreciating the season. As the seasons change to cool, crisp air and winter weather, take time to notice and appreciate the fall and winter months. Notice the leaves on the trees changing colors, windy days, the sound of the rain outside. There are so many simple ways to practice mindfulness when appreciating the season. Identify what you love about the season and be intentional about incorporating that into your daily thoughts. One of the easiest and most accessible ways to connect with nature is to birdwatch. You can do this while out on a walk in the countryside, in a park, or noticing a bird in your backyard. It doesn't have to be anything forward, you're just connecting yourself to nature. You can also mindfully listen to music. How often do we listen to music passively? It's so easy to get lost in your thoughts and stop paying attention to what you're actually hearing. Mindful listening can be done anywhere at any time. If you're at a sofa, if you're at home, you can curl up on a sofa and put on your headphones, as one example. And finally, mindful mornings is another way to experience mindfulness. If you leave until the very last possible moment to get out of bed, sometimes your day can start feeling frazzled, and that's before you've even done anything. The dark mornings can make it harder to rise and feel energetic, but reviewing your morning routine could help you to appreciate your mornings more. Factor in a little bit of extra time for yourself, even if it's the night before, whether it's for stretching, a short meditation session, or simply drinking a cup of coffee or tea mindfully. Giving yourself time for breakfast can also help you to de-stress and can improve digestion as well. Having a mindful morning could help you feel more relaxed throughout the day, but if you can't bring yourself to miss out on that extra bit of sleep, see if you can find a few minutes during your morning just to check in and just to see how you're doing. Resilience. So this is the result of successful adaptation to adversity. It's revealed by an individual's ability to cope and recover from crises, sustain a sense of purpose and vitality, and emerge stronger from stressful experiences. Resilience is a dynamic characteristic that may shift according to the circumstance. It can come in many forms, as an outcome of physical or mental recovery from a traumatic event, as a trait that describes an individual's enduring ability to cope, or as a process of recovering from a stressful event and just moving forward. No matter how resilience is viewed, the tools that foster resilience can result in positive outcomes. So what are some characteristics and behaviors that can lead to resilience? So optimism and effective coping styles, these responses to crises are more often seen from the silver lining point of view rather than from despair. These factors are more important to obtaining happiness than perfect health. Personal connections, so happily engaging with family and friends, close-knit communities, or at paid or unpaid work, volunteering. These deep relationships, they offer comfort in times of uncertainty. Sense of purpose. This stems from being involved in an activity or a function that gives life meaning. This factor creates optimism and affects how one looks to the future. Self-efficacy. This is ability to handle one's own problems and helps attain flexibility or adaptability to new situations. And also healthy diet and active lifestyle. The healthier and the more active adults are, the more factors of resilience they possess, and vice versa. So if you would like to hear more from an expert on resilience, you can access our September 1st recording of the Resilience and Positive Coping Special Event webinar presented by Dr. Dawn Upchurch from UCLA. So there's a lot more detail and information and some tools that she provides on resiliency. Social changes for the holiday season. So the holiday season is coming, will look a lot like last year. Here's how we can prepare once again for the new normal. So as you think about the holidays, now's the time to plan ahead for the safety of your family and friends. Think about those who are at higher risk, so the elderly, young children, those with medical conditions, or anyone who still needs a vaccine. Limit interactions with other people as much as possible. Take precautions to prevent getting COVID when you do interact with others. If you do decide to engage in public activities, continue to protect yourself. Get a vaccine if you haven't already. Keep a cloth face covering, tissues, hand sanitizers on hand. If possible, avoid others who are not wearing masks or ask others around you to wear them too. If you are at increased risk for severe illness, consider avoiding high-risk gatherings. The risk of COVID spreading at events and gathering increases as follows, what's shown on the slide. So the lowest risks, these are virtual activities or gatherings of members within a single household. More risk would be smaller outdoor and in-person gatherings with members from different households spaced at least 6 feet apart, wearing masks and not sharing objects. Most visitors are from the same local area, so the community, town, or city or county you're in. Higher risk, possibly medium-sized in-person gatherings that allow individuals to remain spaced at least 6 feet apart, and visitors are coming from outside the local area. And the highest risk would be a large in-person gathering where it's difficult to remain spaced apart, and visitors are traveling from outside the local area, maybe it's indoors, and not well ventilated. There are several factors that can contribute to the likelihood of attendees getting and spreading COVID at large events. In combination, some of the following factors will create higher or lower amounts of risk. So that would be the number of COVID cases in your community. So high or increasing levels of COVID cases in or around the event location or areas your attendees are coming from, that may increase the risk of infection and spread. Exposure during travel, that could be if you're going through airports, public transports, and rest stops, where there may be poor ventilation. The setting of the event, so indoor places, that can pose more of a risk than outdoor. The time span of an event, so events lasting longer pose greater risk, and then being within 6 feet of someone who has COVID for a total of 15 minutes or more over a 24-hour period, that also greatly increases the risk. The number and crowding of people, and then also behavior of attendees during an event. So events where people are interacting with others from different households, singing, shouting, not maintaining physical distance, or not wearing masks consistently or correctly. Those are all things that can increase the risk. So for event organizers, it's important to continue to assess, based on current conditions, whether to postpone or cancel large events or gatherings, or significantly reduce the number of attendees for events. If it's difficult to put on safety measures in a large event, they may choose to do a virtual event instead. So, are you considering in-person visits with family and friends? Here are some things to consider to help make your visit as safe as possible. So just know when to delay or cancel a visit. Delay or cancel if you or your visitors have symptoms of COVID or have been exposed within the last 14 days. Anyone who has had close contact with a person with COVID should stay home and monitor symptoms to decide if they should get tested. Get fully vaccinated against COVID at least 2 weeks before in-person visits with family friends. This is one of the best tools to help protect yourself and your loved ones. For those who are not fully vaccinated and over the age of 2, it's important to wear a mask in indoor public places. In general, the more people you interact with, the more closely you interact with them, and the longer that interaction, the higher the risk of COVID spreading. So think about some of these questions. Are you fully vaccinated? Are others around you fully vaccinated? How many people will you interact with? Can you keep 6 feet of space between you and others? Will you be outdoors or indoors? Wearing face covering. So in addition to these questions, just think about if you're able to encourage social distancing during a visit, try to be outdoors. Consider keeping a list of people you visited or who visited you and when the visit occurred. If in case there's a case of COVID, this will help with contact tracing if someone does become sick. And then also wear a mask. Those who should not wear masks are children under the age of 2 or anyone who has trouble breathing, is unconscious or incapacitated or otherwise unable to remove the mask without assistance. Be sure to wash hands often, limit contact with commonly touched surfaces or shared items, and then clean and disinfect commonly touch surfaces and anything that's shared between use and then at the end of an event. So for holidays, to help stop the spread of COVID, we need to follow the guidelines for physical distancing. It's important to plan with pandemic precautions in mind, even if you are vaccinated. The CDC continues to advise against larger gatherings and non-essential travel plans, particularly due to the Delta variant. There's a big difference between how holidays were celebrated pre-pandemic versus during the pandemic. This year, there may be some new traditions that carried over from 2020. You may be baking Christmas cookies solo, but dropping them off on your friends' porches, or scheduling a Zoom call with them to watch a sappy Hallmark movie. You can host games over Zoom like bingo or Kahoots. Just focus on being creative and improvising once again this year. So do you ever make it through an entire year without getting sick? Staying healthy year-round, even during the fall and winter months, isn't as hard as you might think. Here are some ways to help boost your immune system. So many fruits and vegetables boost your immune system. Try to incorporate 7 servings of nutrient-rich food into your diet every day. Include whole fruits, garlic, broccoli, and green leafy vegetables, which are laden with antioxidants. Antioxidants help stabilize free radicals, which can damage the body's cell and compromise your immunity. Vitamin C, it also strengthens immunity and stimulates the formation of antibodies, which are the cells that help you fight illness. Although vitamin C can't prevent colds, it may help shorten your cold and make the symptoms mild. Incorporate citrus, such as oranges and tangerines, into your meals. Other vitamin C-rich foods include papaya, strawberries, tomatoes, and red bell peppers. You can get creative with this, put them in salads, or enjoy them as a snack. You can also think about taking supplements. There's a National Institute of Health study that recently confirmed the benefit of supplementing vitamin D. It lauded the importance of vitamin D for a functional immune system and notes a striking prevalence of vitamin D deficiency in people with autoimmune diseases. So supplements, they don't precisely mimic all of the nutrients in whole fruits and vegetables. In other words, substituting an orange with a vitamin C tablet doesn't provide the same health benefits. Your best bet is to eat a more balanced diet for the best immune system boosting nutrients, and maybe work with a nutritionist if you feel you do have a deficiency in your diet that may benefit from supplements. It's also important to stay well in mind and body. You can also boost your immune system just by taking quality time for yourself and getting the rest when you feel you need it. And don't forget to exercise and get enough rest. Eating right, exercising, getting enough sleep, these are scientifically proven to reduce inflammation and to improve your immune system health. So for this slide, here are some meal ideas that may help to boost the immune system. So the first one, orange juice smoothie, there's healthy ingredients that you can incorporate like ginger, carrot, and turmeric that can make a simple immune boosting smoothie recipe. This orange blend can give you energy needed to fight off a cold or a flu. So warm soups or stews, these are also perfect food for when you're not feeling well. Whether it's a cold or a flu, hot soup helps to relieve congestion, it hydrates you, and it's a light meal for when you don't really feel like eating when you're sick with the flu. Soups with onion, carrot, mushroom, kale, celery, chickpeas, things like that. You can just add any vegetables or any meat that you choose. All of these ingredients that can help to shore up and boost your immune system response. And then the last one, you can also add in foods that are high in omega-3 fats. Omega-3 are anti-inflammatory, and then they can also boost the immune system. So the image there is an example of just a simple dill, lemon, and olive oil addition to salmon. You can also pair it with whatever vegetable is in season. And lastly, this is your call to action from beating the winter blues. So keep yourself and those around you healthy this winter season by getting your flu shot and your COVID vaccine if you have not yet. Both help to lower your risk of getting sick and can protect everyone around you. With COVID-19 still in our communities, it's really important to do what you can to avoid getting sick this winter season. For Health Net members, the flu shot is a covered benefit, and the COVID vaccines are free for everyone. Discuss your options with a doctor. You should also ask if you need about flu and COVID vaccine clinics in the area and the schedule for them. Also, try to stay up to date on adult and child immunizations and be sure to check with a doctor on the schedule. You should also practice preventive health strategies. Hand washing is the single most important step you can do to prevent the spread of germs, not just the flu and COVID, but cold viruses and other germs that can make you sick. Cover your cough, sneeze into the crook of your elbow. As your local protocols require, wear a mask and practice physical distancing. Also, maintain good physical and mental health practices this holiday season. Look for opportunities to enjoy the changing season, connect with nature physically or virtually, spend time being mindful, meditate, and practice gratitude. Focus on the positive and what is going well in your life, and try, if you can, try to let go of things that you can't control. As the holidays approach, you can also think creatively and improvise ways to connect with family and friends and those who may be alone during this time of year. Limit gatherings and find ways to celebrate the spirit of the season safely. Try a new recipe with immune-boosting foods, and remember to take time for yourself and to rest. Okay. Thank you so much, everyone. Thanks so much for listening.
Hi, Deepa. Thank you so much for this information. It's so timely with cold and flu approaching us and just what's going on in the community and in the world with COVID-19 and the Delta variant. This was very informative, so thank you so much for your time. You did mention mindfulness throughout your presentation, which brings me to the slide here, myStrength, which is an amazing program. It's an online program that is also available in app form to access through your smartphone so that you can have that support at home and on the go. myStrength is really nice because it helps to reduce stress, anxiety, depression, substance abuse. There's programs on insomnia, COVID-19, pregnancy and early parenting, and more. So it's a really robust program that our members have access to. It has modules and quick videos for mental health professionals. There's guided meditations and also inspirations on topics of joy, laughter, positivity, meditation, just to name a few. So it's there's many different activities on the myStrength platform. And again, it's free for HealthNet members, so please be sure to check it out when you log into healthnet.com. Next slide, please. Right, great, thank you. So health coaching, tackling new health goals can be challenging, but you don't have to face it alone. A health coach can help you prioritize your goals, strategize a plan, and support you through your journey. So we have quite a few different health topics that you can discuss with your health coach for HealthNet members. And if you're not a HealthNet member, please check with your health plan to see what is available to you. And you also have access to the nurse advice line. A registered nurse is ready to answer your questions, so please feel free to call that number right there on your screen to access the nurse advice line. Next slide, please. All right, wellness resources. So as a HealthNet member, you have access to your personal health record, your HRQ, which is your health risk questionnaire. It only takes about 15 to 20 minutes to complete. It'll give you a snapshot of your health status after completing that HRQ, and it will prompt you into specific programs that might be beneficial to you depending on how you responded to the questions in your HRQ. And there's a variety of other online health programs on weight management, tobacco cessation, nutrition, exercise, and more. So please check that out at healthnet.com as well. Next slide, please. All right, healthy discounts. Who doesn't like a good discount? We have discounts to many different programs such as Weight Watchers, Jenny Craig, chiropractic and acupuncture services, eye care, hearing aids and screenings, fitness clubs, and more. So you can access that at healthnet.com as well. Next slide, please. All right, please mark your calendar to join us next month on October 20th for the topic, Keeping Your Lungs Healthy. Our lungs keep us alive and well, and that's why it's important to take good care of your lungs. We will have a guest speaker, Dr. Chima Milton from UCLA. She will be presenting this topic, and we will discuss tips on what you can do every day to reduce your risk of lung disease. We will also discuss knowledge and prevention tips to keep your lungs healthy and COVID-19 and the Delta variant. So please mark your calendar again for October 20th. Next slide, please. All right, thank you so much for your time today. We hope you enjoyed this presentation, and thank you once again, Deepa. You did an amazing job. We appreciate the time you spent with us today. We hope you all have a wonderful day, week, and stay healthy. Take care. Bye.